Hi, I'm Dr. Cynthia Ambrose from Health Now New York. And as part of our series on enhancing quality while responsibly looking at cost containment in healthcare, we've got with us today Dr. Doug Golding, and he is the medical director of Lifetime Health Medical Group here in Western New York, as well as a family medicine practitioner. Doug, when you think about cost of healthcare from the primary care physician's point of view, what do you think are the major areas impacting increasing cost of care today?
Sure. One, thanks for having me. This is a great opportunity to share. And I think we've been struggling with this idea of cost and quality and how we blend them together. And from my perspective, one of the challenges, or great challenges I see is around the whole access to care issue and coordination of care that I, as a family doctor, was trained or thought I was trained to learn how to be the primary caregiver of a patient in the family, help coordinate care and do those things. And what I'm finding in reality is it's not happening. There's a lot of care that happens outside of my office, primary care office, and from a cost standpoint, I see a couple of major issues. One, a significant amount of cost is attributed to hospitalization and emergency care, as well as procedures. And I think when we look at our health system and reimbursement and the fee-for-service environment, that there seems to be an alignment of the reward system in compensation around technology and high-cost procedures and hospitalization and things, and less on the care of the patient right in the office setting, in the primary care setting.
Okay, and the emergency care, what's driving that? You said people going to the emergency department.
I see it from my own practice as, in part, it's a lack of access. So, in fact, we've studied that in our group and looked at what the peak time of visiting the emergency room is. And I was shocked when I saw this. You think it's in the evening or on weekends. It's 2 in the afternoon. And I'm sure you know that as well, having looked at that.
My background in emergency medicine and, when the patients come in, very peak hours, really 2 to 7.
And I know in my own office that the patients are calling by, noon, 1 o'clock, and my schedule's full. And we try to squeeze people in as best as we can. And then the second side of that is patients, I think, get used to going to the emergency room. And so now there's a habit that people have. They don't feel they could get in, so even if my office is able to bring people in, we're going to squeeze them in. By mid-afternoon, they look at it and say, well, last time I called, they weren't available. They told me to go to urgent care or what have you, so I'm just going to go straight to the emergency room. And I also think that there's a certain amount of care that could be given, not in the office, but over the phone, perhaps even nurse advice, for instance. And our group does a certain amount of that, but sometimes a patient wants to deal with the doctor directly or feel like they're at least having that direct contact.
I definitely find that the nurse lines and things that have been provided even through insurance companies are not utilized to the extent that you might think, because people do really want to talk to the doctor, or if they have a relationship with the nurse practitioner as their primary care provider, that as well. But they don't just want to speak with a nurse, especially on the phone, to get the kind of full discussion, I think, that they're hoping for, and just the sense of trust, I think, is still between the patient and the doctor overall.
Yes.
What do you think we can do about that? Getting patients to change behavior and do things a little differently.
I think that to get patients engaged in their own care is certainly I think the number one answer. If ultimately it's the patient whose health is being impacted, it's their wellness or their control of a chronic condition that drives cost in the end. And of course, preventive care and passion of family medicine is preventing illness rather than dealing with it when it happens. I think of the 4 cardinal things that people can do to help themselves be well are exercise, proper healthy diet, not using tobacco products, and not overusing alcohol. And those things, if people would actually drive our costs down more than even prescribing medications.
Absolutely.
Even the things that I can do. I'm not sure I can control that for a patient. I think the patient needs to control that for themselves.
We are really, as individuals, driving the cost trends in healthcare, and we have to take responsibility for that. There's not a pill that you can take. There's not an insurance company claim that can be paid. There's not access to a physician that can be made that's going to change that for the patients. So, you know, we do need to encourage that. What are you doing in your own practice? Can you give an example of something that may have turned the tide for a patient that you've treated that was having difficulty really around behaviors that's made a difference?
I can think of a diabetic that actually I saw, this is probably a year or two ago. It was a woman who had not been diabetic. She had gained a significant amount of weight. We had been talking over the years about weight control and diet control just for general preventive measures. And for whatever reason, she wasn't engaged in that. She didn't have that incentive. But one day she came in with a high blood sugar and was told, "You have diabetes." And I'll never forget the look on her face. She was distraught. It really impacted her emotionally. But we had a long conversation, and I told her, unfortunately, some of my colleagues feel that that's a death sentence. And I said, this is not a death sentence. I said, you can actually reverse this to the point where you're not diabetic anymore, but you need to take control. You need to lose the weight. You need to lose...
what a great message.
Yep, get exercising and things. And, you know, and I wish I had more success stories like this, but this one in particular was phenomenal. She understood personal responsibility and control. She took on that responsibility. 3 to 4 months later, she had lost 60 pounds. She had seen the nutritionist. And it was powerful because we have an electronic health record, and I had hypertension, high blood pressure, diabetes, hyperlipidemia as the 3 cardinal conditions in her problem list.
High cholesterol.
Yep, and we retested her after that point because she had gotten her weight down. I said, this would be interesting to see.
Absolutely.
Her blood pressure was normal, took her off the medications. Her sugar was normal. Her test for the diabetes was normal. We actually redid the 2-hour glucose test, which is the definitive test for it. It was normal. And so I sat with her the next visit, and I said, guess what? You are no longer diabetic, hypertensive, or you no longer have high cholesterol. And I took it right out of her problem list, and we had a hug, and that was the end of that. and the next step was, and I talked to her about this, was to say, you've got to have people in your church, in your community, that are in the exact same situation. And she's been spreading the message.
I see sometimes, you know, the commercials that the pharmaceutical companies use, especially for some of the medications and drugs to lower cholesterol. I should have taken this more seriously. You know, I had a heart attack and my cholesterol was high and my weight was too high. And I should have been taking these medications earlier because I wasn't thinking about my wife and my family. So I guess our little addition onto that is maybe you don't even need to be taking that medication if you really are serious about your responsibility to yourself and to your family. Then maybe you could live a healthier lifestyle and not even be medication dependent, which for most people is a cost issue as well as a health issue. So, you know, it's sort of driving 2 things and 2 possibilities there. If you could talk directly right now to President Obama and his administration, what would you like to tell him to focus on? What would be the sort of the essential pieces in your own mind around cost containment and what we need to achieve?
I think we need to design not necessarily a system, but incentives in such a way that health is the ultimate goal, and we define that, I would define that as a combination of quality. We do need to use evidence-based measurements, and we have to measure, you know, shame on us in the medical community because we have been deficient in measurement over the years, but also in value. And I know President Obama has talked about the value equation, but what is value and value to whom? So that has to be the same across the board, I think. And I think we also need engagement of the patient in that equation as well. They need to have a vested stake. So if we look at who has a stake in the game, it's the whole country, the individual patients, certainly our government, the health payers, insurers, which we direly need, and the medical professional community, where that if the outcome is XYZ, which is health for the patient, keep them out of the hospital, it's not good for people to have procedures unless they really need them, and defining whether they need it or not, that if we meet that outcome, everybody should have some level of benefit. And I would believe there needs to be levels of financial incentives to where everybody gets a level of reward. or less punishment, but I prefer the reward side of it to keep people and to help people stay healthy. I would also say that this needs to get into the community where, and I believe that this is the greatest opportunity that we are missing, and that is to keep people healthy. We need our children, first of all, to be healthy, physically active, to have healthy families, to have encouragement that families that eat together are healthier, children are healthier, they have less depression, they have less obesity, to encourage activities. I think about workplace environment changes such that workplace wellness programs are a great opportunity to think that most of us spend more time in work than we do with those that we love and care for.
Absolutely.
And so why not use those workplace environments as a place to encourage these behaviors and reward those behaviors? And some great examples out there where this is happening now. I think of the Bellin Health System out in Wisconsin, Kelsey Siebel down in Texas. They're doing great work engaging with employer groups to work on that community side and encouraging employees to quit smoking, for instance, or to not smoke in the first place. And they put a carrot out there for them. They pay less premiums on personal contribution and premiums in their health insurance if they engage in these positive activities.
I think very often we get into a place where we feel that the goal is too big. So we have to make sure that we have reasonable goals. But my advice always to patients and to family and other people who require a change in lifestyle is pick one thing and begin.
Really, you're right. It's a step at a time, and let's pick the low-hanging fruit. Everybody can get up out of their chair and walk, or exercise, or pedal a bike, or pick up the pillow on the couch and do this a few times if you've got some disabilities and things, but anybody can do that.
And do something. Using the stairs, we always talk about that, using the stairs at work. And, you know, when changing one level, you know, you don't have to hit that elevator button when you're thinking about it. If you're going 1 or 2 levels in your workplace, think about those stairs. You know, so it's so important. So, Doug, thank you so much. I really appreciate it. And I'd like to thank you for listening. This is, again, one of a series of conversations we're going to be having about healthcare cost, our healthcare environment, healthcare reform, what your insurance company is doing with your money, and some other issues that you might be interested in. You can visit us on Facebook and Twitter, and feel free to even do a video response of your own to this if you so choose. We'd love to hear from you. Yours in good health.